Discussion number 8 for pharmacology. Create a cardiac scenario and show include bike history, initial vitals, chief complaint, and signs and symptoms at minimum. Okay. Marina is a Mexican woman who was admitted to the hospital for the past few months. She has been not feeling well and had been fatigued all day. Also, she felt weakness in the left side of her body. And then with most predominant to the left arm. Sometimes she was presenting shortness of breath at night and a little chest pain and insomnia. She has never been obese, but have a history of hyperglycemia and hypertension. At the hospital, her vital signs were taken and found out that her respirations weren't deep enough, but they were fast. Also, her cardiac rhythm was irregular and the beats were weak. The physician decided to let her be in overnight at the hospital for observations, and the next day they took many electrocardiograms and do an echocardiogram to Marina, and then they couldn't find anything wrong about it, so they decided to take Marina to the cath lab to check why the beats of her heart was like really slow. Right away, the family of Marina was advised that she has to be submitted to surgery because they found out Marina has two veins blocked and they were restricting blood flow back to the heart. And if they didn't do the procedure, Marina could go in cardiac arrest or even respiratory arrest at the time. And then it could be nothing else to do. The initial clinical actions taken in these patients were that, she was put on oxygen overnight and taken by observation. They do various sets of electrocardiograms and echocardiograms to try to identify what her rhythm was so slow and the beats were so weak. And then they take this patient to the cath lab, and then they check the main arteries and veins responsible for the pump of the blood getting back to the heart. And then the last one, and the catheterization of and placement of two hair stains on the veins, on two main veins. Many complications came along with this disease, and the doctor found out that her blood was dropping her levels of potassium and sodium to the floors at a degree where she was all shivering and making her look like she was on kind of drugs, making her looking like a crazy person. The doctor explains to the patient family that Marina went to the hospital with dehydration that was present in athletes with high performance of exercise, and they just were drinking water, so the electrolytes weren't getting back to their normal levels, and then there was wide her sodium and potassium were like dropping to the floors, and these complications made Marina's heart going weakened and her veins going weakened as well, to the time that they could get clogged really easily because the blood pump, it wasn't well. Emerging evidence showed that there is a high risk of cardiovascular disease with a low sodium diet, including individuals with type 2 diabetes. Hypokalemia and potassium depletion are often caused by an increasing loss of potassium throughout the kidney due to no potassium sparing diuretic therapy. This effect is furthermore often aggravated by insufficient potassium intake due to reduced appetite and relative low potassium center of modern form. The pathophysiology of this, when the arterial endothelium encounters certain bacteria, produces a risk of factors that diverse of this lipidemia, vasoconstriction, hormones including the hypertension. Those products of glycoxidation acidotic with hyperglycemia or pro-inflammatory cytokines derived from excess of adipose tissue disease cells with augmentin The expression of additional molecules to promote the sticking of the blood leukocytes to the inner surface of the arterial wall. So, by the way, this wasn't a create scenario patient. It was real life. It was my mom a few years back on, and I'm glad she's back. Well, she's still alive with us. She has two main veins conducting the blood back to the heart. They were clogged already, and they had to do a surgery to place to expanding stents so they can reopen the veins. And she's just like a normal woman again.